Hey all, welcome back to the Reinhartz Rundown. We're starting our All Things Asthma series. Allergies are the sixth leading cause of chronic illness in the US, with one of those manifesting as asthma in both adults and children. We know that these are expensive, cause a lot of ED visits, and we know that MIH and community paramedicine can play a big role in reducing asthma attacks and asthma burden. Asthma is an inflammatory disorder of the airways, causing periodic and reversible obstruction to airflow. Usually it's a response due to an allergen, a chemical irritant, an infection, or even a physical stimuli like exercise or cold air. It's this inflammation or swelling of the airways that make it difficult for our patients to breathe. And really what's happening here as part of that inflammatory response is that when the body gets exposed to something, maybe like pollen or a little bit of smoke from a campfire, it kind of inaccurately gauges how much risk there is and launches this severe inflammatory response and closes those airways. Asthma affects people of all ages, but generally individuals that are low income and minority populations are most affected. We also know that long-term management can be a challenge because it includes a variety of medications and also lifestyle modifications. Because that management is so multifaceted and there are resources that are required, community paramedicine and MIH play a huge role in preventing asthma attacks and helping to reduce the burden in our communities. Over the course of this series, we'll go through all things asthma. We'll talk about the multifaceted approach, different education strategies, how to identify triggers, and putting a plan in place for long-term asthma management. That's about it for today. If you're interested in asthma management inside the home and home visits to help reduce the amount of asthma attacks a patient has, make sure you subscribe, and we'll see you on the Reinhartz Rundown.